That stubborn ring around your waist is not always about eating too much. Sometimes it starts with a breakfast that spikes insulin, an inflamed gut that leaks irritating compounds into the bloodstream, and a metabolism that spends the whole day playing defense. If that sounds uncomfortably familiar, stay with me, because one of the oldest spices in your kitchen may help with all three. Not by magic, not overnight, and honestly, not in the exaggerated way social media loves to promise. But there is a real reason this bright yellow spice keeps showing up in studies on waist size, inflammation, insulin resistance, and the gut barrier. Most of you already know I am talking about turmeric. The same spice that permanently stains your chopping board can also influence the very systems that make belly fat so stubborn in the first place. And in a moment, I will explain why simply sprinkling it on one unhealthy meal is not enough. Because there is one mistake that cancels most of the benefit before it even starts. I am Dr. Steve Collins. As a doctor who spends a great deal of time helping people lower inflammation and protect long-term metabolic health, I want to show you exactly how turmeric may support belly fat loss and gut repair, where the evidence is solid, where it is limited, and how to actually use it in real life. I started paying close attention to turmeric years ago because I kept seeing the same pattern in people over 40. They were not eating huge amounts, but they had bloating after meals, evening cravings, and that heavy, stubborn feeling around the middle that just would not shift. You know exactly what I mean. Here is the biology, and it is simpler than it sounds. When the gut lining becomes irritated, it behaves like the rubber seal around a front door that has started to crack. Tiny compounds that should stay inside the digestive tract slip across more easily. The immune system reacts, and suddenly the body is living in a low-grade inflammatory state around the clock. That is not automatically a formal disease. I am not going to overstate it. But increased intestinal permeability is a real physiological concept. A 2024 paper in Cellular and Molecular Life Sciences linked obesity and type 2 diabetes to increased intestinal permeability and inflammation. And an NIH-hosted review discussed curcumin's effects on gut inflammation, intestinal permeability, and the microbiome. This matters more than most people think. So does turmeric actually heal a leaky gut? I would phrase that more carefully. What it appears to do is support the gut barrier and reduce some of the inflammatory signals that keep that barrier irritated. Think of curcumin, the main active compound in turmeric, like a skilled mechanic, not rebuilding the whole house, but helping calm the fire alarm and tighten a few loose screws while the real repair work happens through sleep, food quality, stress control, and a better meal rhythm. A broad scoping review published in the International Journal of Molecular Sciences in 2023 looked at hundreds of clinical trials on oral curcumin and found its most common human applications were in metabolic and inflammatory conditions. That does not make it a cure, but honestly, that is quite remarkable for a kitchen spice people have used for centuries. Use turmeric with actual meals rather than randomly between them. Add it to eggs, lentils, vegetables, soups, or a yogurt-based marinade. Food gives it a job to do, and using it consistently beats using a large amount once in a while. Now, the belly fat side of this is where people get excited, and I understand why. I have a habit of measuring progress by waistline rather than body weight, because the scale can flatter you one week and frustrate you the next. Your waist tells a more honest story. Belly fat is not just sitting there passively. It is hormonally active. It releases inflammatory chemicals, worsens insulin resistance, and makes the body more likely to store energy rather than burn it. So where does turmeric fit? Not as a fat burner in the stimulant sense. More as a brake on the very processes that make abdominal fat so hard to lose. A dose-response meta-analysis published in Critical Reviews in Food Science and Nutrition found curcumin supplementation led to modest reductions in body weight, BMI, and waist circumference across randomized trials. A 2025 meta-analysis in Nutrition and Diabetes, focusing on people with prediabetes and type 2 diabetes, also reported reductions in waist circumference. The keyword is modest, not dramatic, not miraculous, but genuinely useful when layered onto the basics. Pair turmeric with the meal that usually leads to your worst cravings later in the day. That is often lunch or dinner, and that is where the domino effect begins. Then there is the insulin piece, and not enough people connect this directly to their waistline. I have a personal rule when I am trying to stay sharp. I do not let the first half of the day become a parade of sweet coffee, biscuits, and casual snacking. Because once insulin starts bouncing all over the place, the afternoon unravels completely. Belly fat loves that chaos. Curcumin is interesting here because the evidence points not only to inflammation, but to glucose handling as well. A 2023 umbrella review and updated meta-analysis in PLOS1 looked at turmeric and curcuminoids in people with diabetes, prediabetes, and metabolic syndrome, and found improvements in several glycemic and metabolic markers across randomized trials. A 2022 randomized clinical trial in Nutrition Journal tested curcumin in people with metabolic syndrome and found improvements in metabolic control. That does not mean turmeric lets you eat whatever you like, not even close. But it does tell us this spice can nudge the body in a better direction when the rest of the routine is sensible. Put turmeric into a real lunch, then take a 10-minute walk after eating. You are combining better glucose handling from the meal with muscle activity that helps pull sugar out of the bloodstream. Simple, effective. Now here's the trap I want you to avoid, because this is where good intentions go completely wrong. People hear that turmeric is healthy, then they wrap it in sugar, pastry, syrup, or late-night snacking and wonder why nothing changes. It is like pouring fuel additive into a car while the handbrake is still on. The context decides the outcome. A randomized trial published in 2019 in Complementary Therapies in Medicine found that curcuminoids plus piperine improved liver-related and glycemic markers in people with non-alcoholic fatty liver disease over 12 weeks. Why does that matter for belly fat? Because the liver sits right at the center of this whole story. When the liver is overloaded by excess energy, especially from ultra-processed food and alcohol, fat storage and blood sugar control both deteriorate rapidly. Use turmeric earlier in the day and around meals you cook yourself, not as a permission slip for takeaways or desserts, and stop drinking your calories so often. Calories you chew come with satiety signals. Calories you sip slip past the brakes far too easily. The best results always come when the spice becomes part of a consistent pattern, not an occasional performance. Here is something I want to say plainly, because I see this everywhere. A lot of you are not gaining abdominal fat because your body is broken. You are gaining it because your metabolism keeps receiving mixed signals. One moment you flood it with refined starch and sugar. The next you skip a meal. Then late at night, you raid the kitchen because your appetite hormones never found a stable rhythm. Turmeric makes the most sense when it sits inside a more stable routine. In a 2015 randomized, double-blind, placebo-controlled trial published in Clinical Nutrition, people with metabolic syndrome who took curcuminoids with piperine for 8 weeks saw meaningful reductions in inflammatory markers. Why do I care about that? Because inflammation and insulin resistance feed each other in a loop. You store more fat, particularly around the middle, and then that fat drives the inflammatory loop even harder. Tomorrow, do one practical thing. Build one meal around protein, fiber, and color. Then add turmeric on purpose. Chicken with olive oil and vegetables. Chickpeas with cumin and turmeric. Salmon with roasted cauliflower. Simple works. In a moment, I will tell you why black pepper matters more than most people realize. But before that, if you are finding this useful, please hit the like button, subscribe to the channel, and share this with someone who keeps saying they cannot shift belly fat no matter what they do. It genuinely helps this information reach more people. And that is the entire reason I make these videos. Okay, the black pepper piece. This is probably the most overlooked part of the whole conversation. I have a small ritual when I cook with turmeric. I almost always add a twist of black pepper and a source of fat. Not because it sounds trendy, but because curcumin on its own is absorbed rather poorly by the body. If turmeric is a talented guest arriving at the party, black pepper is the friend who actually gets it through the door. A classic human pharmacokinetic study published in Plantamedica in 1998 found that combining curcumin with piperine, the active compound in black pepper, dramatically increased bioavailability in healthy volunteers. That is why people keep pairing the two. You do not need to turn your dinner into a chemistry experiment. The kitchen version is enough for most of you. Add turmeric to food that contains some fat, olive oil, eggs, tahini, yogurt, or avocado, and include black pepper alongside it. That is a practical way to respect the biology without overcomplicating it. And if you are sipping a sugary turmeric latte from a bottle and expecting it to flatten your waist, honestly, that is like pouring water into a bucket with a hole in the bottom. There is another reason I value turmeric, and it has less to do with calories than with comfort. Many people with a struggling gut do not just feel bloated. They feel noisy inside, gurgling, urgent, tender after meals. I pay close attention to that because when digestion feels irritated and unpredictable, people naturally start choosing softer, more processed, easier foods. And those foods often make the whole picture considerably worse. Curcumin has been studied in inflammatory bowel conditions, and while that is not the same as everyday bloating, it tells us something meaningful about how it interacts with the gut environment. That said, if you have bleeding, unexplained weight loss, anemia, severe pain, or persistent diarrhea, please get proper medical assessment. Do not self-diagnose from a comment section. For ordinary digestive irritation, here is a very practical tip. Use turmeric in savory meals first, not sweet drinks. Sweet drinks often add sugar without satiety, and that defeats the purpose entirely. Now, here is something that genuinely surprised me when I started explaining this to patients. The people who benefit most from using turmeric are rarely the ones doing the most dramatic things. They are the steady ones, the ones who sleep a bit better, walk after dinner, and stop treating every meal like a reward or a punishment. That matters because belly fat is not just stored energy. It is a signal-sending organ. It communicates with the liver, the pancreas, the immune system, and the brain, all day, every day. A 2021 umbrella review in the American Journal of Clinical Nutrition found curcumin had small but significant benefits on weight-related measures, particularly in certain subgroups. Small but significant. That phrase matters more than people give it credit for. It sounds less exciting than a miracle claim, but it is far more useful in actual life. Make your evening meal boring in the best possible way. Predictable. Protein, vegetables, healthy fat, some slow carbohydrate if you need it, turmeric and black pepper for flavor, then stop eating 2 to 3 hours before bed. That one habit alone lowers the metabolic noise considerably. And when the noise drops, cravings usually drop with it. A lot of you will want to know exactly how much turmeric you need. Fair question. I am not going to overstate the evidence because many of the stronger clinical trials use concentrated curcumin extracts rather than the amount you would shake from a spice jar. So no, half a teaspoon on its own is not a substitute for a complete lifestyle change. But culinary turmeric is far from pointless. Think of it like brushing your teeth. One brush does not transform your mouth, but the daily pattern changes the trajectory over time. That is exactly how I want you to think about this spice. A teaspoon a day across meals is a sensible food-based habit for most people, assuming it agrees with you. Scrambled eggs, soup, a bean stew, roasted vegetables, it all counts. Now the important caution, and this part gets ignored online far too often. The U.S. National Center for Complementary and Integrative Health notes that turmeric products may cause gastrointestinal side effects and may interact with certain medicines. If you take blood thinners, have gallbladder disease, are preparing for surgery, or have persistent reflux that worsens with spices, speak to your doctor before getting enthusiastic about high doses. And this next point matters just as much as the spice itself. If your diet is full of ultra-processed foods, alcohol most nights, and very little fiber, turmeric is not going to rescue you. You already know that. But sometimes it helps to hear it plainly. The gut lining likes routine. It likes fiber, fermented foods if you tolerate them, enough protein to maintain the tissue itself, and enough sleep for repair hormones to do their work. Turmeric can support that environment. It cannot replace it. I often tell people to imagine the gut lining like a lawn. Curcumin may help calm the damage, but you still have to stop driving the car over the grass. One practical move for tomorrow: build a plate that looks alive. Beans or lentils, leafy greens, extra virgin olive oil, herbs, salmon or eggs, turmeric, and black pepper. Chew it slowly, eat seated, then take a 10-minute walk. That combination is boring to the internet, but it is beautiful for biology. Stay with me, because the final piece is the one that turns this from a spice trick into a lasting result. The final piece is patience. Not sexy, I know, but it is true. I have never once seen a healthy waistline come from panic. It comes from repeated, calm decisions that lower inflammation, improve insulin sensitivity, and help the gut stop shouting at the immune system all day. Turmeric fits into that picture beautifully, because it is easy, cheap, ancient, widely available, and completely ordinary. And ordinary things are often the most powerful when you actually repeat them. So here is the simple starting plan. In plain English, without turning it into a fad. Use turmeric most days in savory meals, add black pepper and a little fat. Keep sugar and refined snacks from crowding out real food. Prioritize sleep. Walk after meals when you can. Watch your waist more than your weight. And if your gut symptoms are severe or persistent, get checked properly rather than self-diagnosing from a comment section. Thank you for spending this time with me. If this helped, please like, subscribe, and share it with someone who needs a calmer, more realistic approach to belly fat and gut health. And take a look around the channel, because I have done a full video on inflammation, insulin, and food habits that will help you go even deeper.